Toxicity with the treatments is always a big issue, and basically what our philosophy is, we tell patients with stage 4 lung cancer, we're hoping to help you live longer and live better. If you have side effects, or symptoms I should say, we're hoping to alleviate those. If you don't have symptoms and you got good quality, we're hoping to maintain that as long as possible. So when you're talking about symptoms, you have to really go into it in detail. It's a combination of the physicians and the nurses working with the patients and their families to answer their questions. And one of the things that kind of is surprising, or was surprising to me when it first became apparent, like things like the EGFR inhibitors, hey, it's just a pill. You just take a pill every day. It's not like coming to get IV chemo and being in the infusion room for hours. It's so much easier. But for some patients, that particular treatment may actually be harder than chemo. Depends on the chemos. You and I have talked about before. Certainly some of the chemos, for instance, like pemetrexed, where you don't lose your hair and you don't have neurotoxicity, and you can take it for a long time as a single agent as maintenance. For most of the patients, that's pretty easy. Some get fairly tired from that drug, but if you don't have significant fatigue, the rest of the stuff is usually pretty easy. But the balance is, you want to have prolongation of life, and you want to have the best quality of life. You want people to be able to do their usual daily activities. That's what's very important, and that's they verbalize that over and over. Or if they have major life events they want to get to, the birth of a grandchild, somebody's getting married, somebody's graduating from college. These are big things for the patients and their families, and that's in stage 4 lung cancer. That's what we're trying to do, is to help them get to those points and to have the best quality of life. And the other thing that I think we talked a little bit about is that just the 30% of people that get benefit, the adenos that never smoked and kind of have slowly growing tumors. Actually, I think there's probably about 60% of the people that are the ones that are likely to get benefit from multiple lines of therapy. And they're the ones, when you start out doing a maintenance trial, they start on a regimen, sometimes dealer's choice or sometimes pre-specified. About 60% of them get the 4 cycles. That's the group that benefits from maintenance, from either an EGFR inhibitor or pemetrexed. It also, in my experience, is the group that gets a response to the 2nd regimen, the 3rd regimen. And one of the things that we're actually looking at our data right now, and there have been a few things, one at ASCO last year in a paper in anti-cancer research from a Japanese group, going back to a carbo or a platinum-based regimen as 3rd, 4th line therapy and actually seeing a bona fide remission. It's kind of surprising. I don't know what the percentage is, but there's no question we see they're clinically meaningful. People get better, they feel better, tumor shrinks, and like going back to a paclitaxel, carboplatin, bevacizumab, or back to pemetrexed and carboplatin. Sometimes even use cisplatin, vinorelbine, and cetuximab as a 3rd or 4th line regimen. Some people might shudder to think that. We do modify it. We don't give cetuximab every week. But the point is that some of the patients, they respond and they benefit from it. And it's that group that's kind of in the treatment sensitive. And our hunch is they're probably more epithelial-like tumors. And when they cross over and become more mesenchymal, sometimes it happens, I think, rather quickly, then nothing touches them.